When I look at SAM's impact in 2018 of our medical professionals in Syria and beyond, I think of three words: persistence, perseverance, and hope. We persisted despite the numerous challenges that we faced in East Ghouta and Daraa because we needed to provide assistance that no one else could in the places where we're working.
After 8 years of violence, displacement, and systematic attacks on healthcare, Syria remains the worst humanitarian crisis of our time.
Medics say they aren't able to cope.
We lost doctors and nurses. There are women and children dying. We want these massacres to stop.
500,000 Syrians have been killed. More than 12 million are now displaced by conflict, including 5 million in neighboring countries, and an estimated 13 million are in dire need of humanitarian assistance inside Syria. During the first half of 2018, East Ghouta and Daraa witnessed a horrifying escalation of aerial and chemical attacks, killing hundreds of civilians, half of whom were children and women. The escalation forced over 130,000 civilians to evacuate to other areas in northern Syria, after having endured 5 years of bombardment and siege.
إنه قدمنا خدمة طبية للناس طوال 5 سنوات بالحصار، والناس تعودت علينا. صارت تفكر فينا حتى لو ما هي مريضة، صارت تفكر بالمستقبل إذا رحنا شو وضعنا. نتمنى العودة السريعة إلى أهلنا، بيوتنا، مشافينا، عياداتنا، مرضانا.
Despite these challenges, SAMS expanded its operations to meet growing medical needs inside Syria and beyond. SAMS provided more than 3 million medical services in 8 countries and spearheaded new medical relief initiatives. In Syria, SAMS opened new specialized centers, including 2 oncology centers in Idlib and Daraa, treating 331 cancer patients. In April 2018, SAMS partnered with Direct Relief and the International Diabetes Federation's Life for a Child program to deliver 15,500 vials of insulin to more than 700 Syrians under the age of 26 with type 1 and 2 diabetes. In 2018, SAMS partnered with other international medical relief and humanitarian organizations, including OFTA, UNFPA, Direct Relief, Médecins du Monde, WHO, and many more, delivering more than 580 containers to its 60 medical facilities in northern Syria.
يراجعنا عدد كبير من المرضى من أجل الحصول على خدمات الصحة الإنجابية. نقوم بإجراء ما يمكن إجراؤه وفق الإمكانيات المتاحة لدينا، ونعمل على تطوير إمكانياتنا بحيث نستوعب أعداد أكبر من المراجعين وتحسين خدمات الصحة الإنجابية.
SAM's mental health and psychosocial support programs in neighboring countries expanded, launching a 9-month pilot project in Lebanon to integrate psychosocial services with gender-based violence and other medical care support in the Bekaa Valley. SAM's medical missions provide quality, specialized services to refugees and underserved host communities in Lebanon, Jordan, Egypt, and Greece. In 2018, 519 volunteers from across the world provided care to more than 27,000 beneficiaries. SAMS also supported local clinics with the help of partners in Greece and Bangladesh.
There's a lot of work which is left behind rebuilding Syria. It might seem that everything has calmed down, but these people need all sorts of support: psychological support, medical support, financial support. We still need to keep doing what we are doing. We cannot stop.
أكيد بعد كل عذاب وكل جهد وهيك، يعني الواحد إذا شاف بنته يعني صارت يعني مشيت وصارت تسمع وتحكي وتطلع بين رفقاتها وهيك وتدرس بكرة تصير بالمستقبل، كتير يعني شعور كتير حلو.
The fact that I could use a skill or a profession that I have and do something for other people at no cost was really rewarding. To be able to see an international collective of like-minded individuals doing some good, it was really great. People would consider seeing this many amount of patients a day hard work, but it's been the most fun I've had in a long time.
Our continued focus on chronic care included a dialysis campaign to continue care in Syria, Lebanon, and Jordan. SAMS also conducted 2 kidney transplants for dialysis patients in Jordan. Throughout 2018, SAM's global response activated to support critical needs for the Rohingya refugees in Bangladesh and continued its work with refugees and migrants stranded in Greece. SAMS launched SAMS Community Outreach to respond to natural disasters and crises that have exacerbated the lack of access to healthcare for impacted populations around the world. Throughout it all, our volunteers and staff met patients with incredible stories of loss and resilience.
One thing that we'd like to help them with is to provide their children, their family, with dignified healthcare. That's something that we can contribute, and we have been doing for years, and hopefully we can do even more in 2019.
Our impact is impossible without our selfless community of donors, supporters, and members. Have a lasting impact on someone's life today by supporting our medical relief work. Your gift will make a world of difference for a patient struggling to access care.
ليش ما تخبر